If you're having a problem that's bothering you enough, that's really impacting your quality of life, I think it's worth having it checked out and really getting the full information to understand what your options are. So I'm Dr. John Engler at North Carolina, neurosurgery and spine specialist. I serve as a neurosurgeon as well as the medical director currently for the group. We have an outpatient clinic, and then we also do call coverage, so emergency stuff that comes through the ER. Certainly my favorite part is the patient care, patient interaction, performing the surgeries, seeing the outcomes of the patients, and the smiles on their faces when they couldn't walk down the hallway and now they can walk down the hallway. It's seen in the office, we get an evaluation, get a sense of the symptoms. If we don't have any imaging to evaluate, which sometimes we don't, we'll obtain the appropriate imaging. And then I'll sit down with you, I review the imaging in detail with you, kind of try to explain how it fits with your symptoms. And then I usually go through the options for treatment, both non-surgical and surgical options. Usually we do some non-surgical stuff, and that's often quite effective, but if it's not, then we do surgery. I'll see you several times post-operatively and help to guide you through that process, usually involving some physical therapy in the post-operative setting. I'd probably say the most interesting one is I had a patient that told me I saved his marriage. He was having back problems, and apparently, according to his wife, he was not a very pleasant person. He'd been dealing with this for several years, and then I saw him and did a back surgery, and right around the 3 or 6 month mark, he's doing very well, pain's much better. And he said, you really saved my marriage because my wife was getting ready to leave me. One of the things that I love about neurosurgery is the involvement of both the brain and the spine and the complexity of each. So if you look at just lumbar spine, there's a lot of different options for how you treat things. There's a lot of different pathologies involved. We really have a wide variety of things that we treat. Spine surgery oftentimes gets a bad rap because people will say, don't ever have somebody operate on your back, it doesn't work. But really, if you match the symptoms to the findings on the imaging, and you treat that imaging finding, people really do quite well. And so it really can be a life-changing operation. It doesn't always have to be a big operation. A lot of times minimally invasive surgeries or smaller surgeries are very effective. And we really help to restore people's quality of life.